So again, yesterday was actually World Mental Health Day. Even at that, we still see quite a number of things that we are not comfortable with in our society, even within our vicinity. Even those who are completely and beautifully dressed. Sometimes when they ask, you are forced to ask some questions. You know, in our local parlance and what we do on the street is, this one well at all, you know? You see some very gentle, manly looking, handsome men and beautiful ladies, well dressed, corporately dressed, you name it. And then when they behave, you begin to doubt their mental state of health. You know, so when you see people like that, the first thing that comes to your mind is maybe some kind of small problem here and there. But what could trigger mental health problem in somebody? What are those indices we have to look out for? What are those things that will make you think that you do not feel all right? In this part of the world, forget it. Visiting a psychiatrist is a big problem, except of course when that person is actually exhibiting some tendencies that you may call mental state disorder and all of that. Okay, that is the only time people will go to the hospital. Even at that, a lot of us will still live in self-denial. Why would you take one way if you're mentally all right? Why would you beat traffic if you're mentally okay? You know, there are so many things you ought not to do if you are stable, if you are sound, if you're okay. These are many more we're going to be looking at today as we introduce to you a psychiatrist today, Dr. Mary Ehimigbai. She's from the University of Benin Teaching Hospital, and it's a pleasure to have you join us today.
Thank you.
It's been a while. I was thinking that, you know, maybe because of the strike, a lot of you doctors just, you know, left the country yourself.
Thank you. Afternoon, viewers. Nice to be here today.
All right, doctor. Yesterday was World Mental Health Day. You know, a special day created to, you know, create more awareness on the issue of mental health. Now, talk to us. Why do you think that day is special? Before we go to the team, why do you think we should have a day set aside to create more awareness?
Actually, World Mental Health Day was set aside to create awareness about mental health issues.
Yes.
It's not actually talking about mental illness. It's not addressing the people that, in quotes, have a diagnosis.
Yes.
It's actually to address those that think they are sane, to help them keep their sanity. It's for stakeholders, you and I, everyone, to talk about mental health issues, you know, with a view to harnessing resources and mobilizing efforts, you know, geared towards improving the mental health of all. That's actually the essence of this day that was set aside by World Health Organization.
Honestly, I think that day should be like once every month or twice every month, putting the situation on ground now into consideration. Now, let's look at the theme. What informed the theme for this year? What is the theme actually?
The theme actually is mental health in an unequal world. That's actually the theme for this
unequal world.
Unequal world, inequities, inequalities everywhere. Okay, it actually stems from the fact that, you know, the world is highly polarized.
Yes.
There's, you know, the gap between the rich and the poor is getting wider. They actually hinged it on income of people.
I doubt if that gap can ever be bridged.
Yes, so people have issues, people are stressed out. With the COVID-19 pandemic, it worsened the issues of people. That's actually why the World Federation for Mental Health decided that, oh, this world is unequal and it's impacting on the health of people, you know, negatively. So let's talk about it. So these inequalities, there are many factors, you know, that makes the world, in quotes, unequal.
Let's look at some of these factors.
Okay.
That create this problem on ground at the moment.
There are general factors anyway. The
course.
one I mentioned earlier is finance, okay? Inequality in finance.
Yes.
Some persons have the income, some do not have. And this is a recognizable fact that is affecting the mental health of people. Social determinants of health, education, housing, you know, employment. These are social determinants of health, things that when people have, it tends to improve their health.
But unfortunately, people don't look at it that way. People don't see it as a problem.
It's a problem.
If you're not rich, you're lazy. If you do not have accommodation, you did not hustle enough.
It ought not.
If you're
to
not
be so.
educated, probably because you don't want to, or because one's parents are poor, you cannot help.
It ought not to
and
be
they
so.
do not, and nobody sees it as anything. It's like it's your problem. It's your problem. But forgetting that that problem may boomerang someday, and it will become a community thing.
Yes.
Before you know what is happening, it can become a nation thing.
Let me tell you what someone said. He said, it's this inequality we're talking about in mental health issues is an unfair and avoidable differences in the mental health of people all over the world.
How so?
What makes it unfair? Because they don't happen by chance. They are socially and politically determined. Okay. Just to answer that your question, that actually it's not because people are poor. People are lazy actually. They're hustling, they're striving, but the environment is not just conducive for them. So these things, they are rooted in policies, okay, that does not improve, that does not help in improving the mental health of people. You know, so it's not just because of individuals. The environment has a lot to do.
Okay, the environment has a lot. Government policies is not helping, and then even to ourselves, we're not even helping each other when it comes to this issue. What are the things we're supposed to do as human beings, at least, to make sure that these factors you've mentioned do not affect us, do not get us depressed, do not lead us to that situation where people begin to like murder each other or commit suicide, as the case may be? What do we do as normal human beings?
To a great extent, though there are limitations to what individuals can do, okay? But I would say here that you focus on positive things. You don't, you cannot help the situation around you.
How do you tell a hungry man to focus on positive things?
That's why I said
a woman whose child is ill, she doesn't have money to go to the hospital. A man who does not have a job and landlord is on your neck, and you ask that man to focus on positive things.
That's why I said
it's going to be difficult.
These things, they are not within the confines of the individual. It's just the environment the individuals found themselves. That's why I said government policies has to come in here. You know that 75 to 95% of persons who need mental health care, they don't have access to it. Why? Because they can't afford it. Accessibility is a problem. Affordability is actually a problem. People can't access.
That seems to be a general thing in the health sector.
Yes, yes. People, do you know that a drug, there's no investment in mental health. Do you know that a drug that is actually useful for mental health treatment, before it gets to the populace, it takes 15 years. Researchers found that today this drug is useful. It's going to take another 15 years before it will get to the populace. Yes, that's how bad it is. There's no investment. There is, I told you before, government policies has to come in here. The gap between the poor and the rich that the World Federation of Mental Health hinged this topic on is actually not in the confines of individuals. Let's be frank about it. Let's be frank about it. But we'll have to say, if you have mental health issues, see a doctor.
Okay, now how can one know that he or she has mental problem? Because you see, there are so many of us on the street. Okay, the other day there was an accident somewhere, somebody's car, and then the guy was removing his tie. He said, "Guy, I know well, as they see me so." You know, that kind of thing. Was removing his tie. He said, "I beg, will not do this. Let's go to your panabita." And then he was removing his ties, folding his shirts, and then he was continually telling the man that offended him, "I know well, you know." So how can we now know when we are suffering from mental problem?
Yes.
Because I want to know. Sometimes one is forced to do some kind of things that will beat you hollow.
There's actually a change in personality. Okay. When someone who is naturally quiet now becomes talkative, there's a change in personality. Okay. Irritability, like you just explained, that person becomes, you know, unusually irritable. Unusual sadness. People have low moods at one time or the other, but when this unusual sadness is persistent, then someone has to check it. Loss of interest in activities one used to enjoy, you know. Low energy, the person, everything is an effort. The person is not actually able to do things except the person makes frantic effort to do them. Okay, those are some pointers to the fact that someone needs to check it. You know, some persons have increased energy. That one, like you said, everybody would know. When someone has increased energy, distractibility, poor concentration. People may have suicidal thinking. All that points to the fact that it's not all well. You know, those are some of the symptoms. Stress, anxiety, fear, and all of that.
All of this you've mentioned happens to a lot of us. Fear, anxiety, particularly fear of the unknown with the economic situation, and then people get angry easily. Yet, none of these persons will want to visit a psychiatrist because I know they craze. That is what you will hear. You get angry unnecessarily. You see grown-up adults fighting like kids. Husband and wife are not loving anymore. Any little thing, the man is angry, the wife is angry, the kids are angry. You know, there's so much anger in the system.
Yes, that's why I said this talk is not about people that have mental health diagnosis.
Yes.
There are a lot of persons who has issues with their mental health, but they do not have a diagnosis, in quotes. Now, the problem of stigma and discrimination is still a major problem in our society.
Okay.
Let me give you an instance. If someone comes to your church and says, oh, he has blood pressure, he has sugar, and he went to see a doctor and he's well, praise the Lord, everybody will say hallelujah. But if someone comes and says, oh, I had issues with my mental health and I went to a psychiatric hospital, even you, sorry, I this word, the next time you come to church, you would like to stay somewhere.
Stay far
you don't
from
want
that
to
person.
stay close to the person. So this issue of stigma and discrimination is a problem in our society. Otherwise, people just, at some point or the other, you needed to visit a mental health physician to say, look, looks like I'm losing nuts, because there are factors that will make people lose it. There are so many factors, it's a myriad of them. I don't need to be saying them because people know the issues on ground. So that's discrimination and stigma. That's apart from the income, inaccessibility, and inability to afford the health care services. Stigma is a major problem.
Is it so expensive? As a psychiatrist, is it so expensive to assess?
No, it's not actually so expensive. It's just that people lack awareness. Again, the stigma I'm talking about is the problem. Some persons would say, oh, I wouldn't want to go to a neuropsychiatric hospital. I want to go to a general hospital. That brings me to the fact that, that brings me to the fact that primary health care centers, if we could have mental health services in primary health care centers, it will go a long way. So the people there in the villages, people around, you know, in communities where they cannot access, you know, in quotes, federal government services like UBTH and all that, they can go to primary health care center and see a psychiatrist.
From the little research we've made, we know that in these healthcare centers, you hardly find doctors.
Yes.
You hardly find doctors there. You find nurses, other health workers, but not doctors.
Not to talk of a specialist.
Not to talk of a specialist.
So you see the ingrained problems we have. Not to talk of a specialist. These are things that could be done to improve the mental health of people. If it's possible. It's possible, actually. It's possible. It's just will and policies that one can bring up. You know, the government has to do something. Let's be frank about it.
Now, we've talked about government. What can individuals do, you and I? Because sometimes if you wait for government intervention in some things, it may not come as early as you want. It may not come even in 10 years.
Yes.
So, but what can you and I and the man, the woman watching out there do in the interval?
Well, in the interval is to watch out, be a brother's keeper, to watch out for some of these signs and symptoms in our neighbors and even in ourselves.
Let me tell you, if I notice such a thing in my neighbor, it will be like, consign me. You
Yes,
know,
that's the attitude.
it's not. It will not be my business somehow. That will be the attitude of a lot of persons. Nobody care anymore these days. Gone are those days where parents will be leaving for work or for the market. They leave their kids with neighbors and say, okay, I'll be back shortly. You can't do that now.
Yes.
You can't do that if you're not careful, if you're not mindful. Before you come back, something would have happened to that child.
Yes, if we bring back the culture of being your brother's keeper, I think it will go a long way. And that's why we're doing this enlightenment. So
that's
people
going to be
know,
like wanting a camel's hair to pass
so
pass
that
through the
people
needle
know
eye.
the signs and symptoms, and then they are able to know that, oh, I should access mental health care.
Okay, after knowing these signs and symptoms, and you've noticed it okay, let's take a home as a case study now. Okay. In a home where you have so much pain, so much agony, the kids are doing one thing, the father is doing another thing, the mother is doing another thing, uncles and all of them. Let's look at a small community now where all of the symptoms, 1 or 2 or 3 persons are already exhibiting the symptoms. How do we tell that person? You're a psychiatrist now. How do you tell that person to say, you need psychiatric evaluation, you need to go to the hospital? Because it's a difficult thing to say. A wife cannot even say it to her husband. The husband cannot say it to the wife because something can just happen if they are not understanding enough. How can you walk up to your wife to say, my dear, you need psychiatric evaluation?
No,
and then the husband says, oh, you need to see a psychiatrist. It's a difficult thing to do.
No, that's not where you start from.
How do we start?
Even in the hospitals, you don't just see a specialist.
A specialist, okay.
You understand? You go to the general physicians. So in that case, the wife should be able to tell the husband, please, you need to see a doctor.
When the man is not sick, is he himself a hale and hearty?
Yes, you need to see a doctor. The woman will tell the person, I think you're stressed. What if you see a doctor so you can have some pills to get you relaxed? So the person can see a general physician. It's
so easy for you to say because you're in the field, and I'm sure you've talked to a lot of persons, you've counseled and all of that. But I tell you, it's not so easy, no matter how sweet you want to put it.
I agree with you, but some do come. I've seen some persons who felt stressed and they felt that, oh, they have a relative, they have a family history of mental illness, and they came to the family physician and said, I think I have this history, and the way he or she is feeling stressed these days. And the family physician referred to us. There's no two ways about it. Issues are abound, okay? Yes. So I just think we should enlighten people that it's not a big deal. See a family physician that would now probably refer you to a specialist. That's the way it should go. If you think because of stigma, you don't just want to see the psychiatrist directly.
You know, this COVID-19 lockdown thing exposed a lot of things that people go through.
Yes.
You know, there was lockdown, husband and wife are forced to, you know, see each other every day, every minute, every hour, and the kids and all of that. And then we discovered that there was a high rate in sexual abuse, violence against women and even young children. We also discovered that there's a lot of tension. Some men murdered their wives, some women murdered their husbands, some, you know, caused serious bodily harm to each other. Now, in a situation like that, what is that person supposed to do? Are we supposed to tie that person up? There's so much violence, and when we have so much violence like that in our society, in our homes, it is, I think it's a mental problem, but people don't see it that way.
Stress-induced mental problems,
yes,
if I will put it that way. Now let's elaborate a little on what COVID-19 caused, because this topic, this mental health, is also hinged on what COVID-19 pandemic cost to the people all over the world. Let's look at small businesses that collapsed, okay? For now deepened poverty and deepened and widened the gap between the rich and the poor. Let's look at premature exposure to social media. That caused problems for people. People haven't recovered from that. Let's look at the one it did, you know, to people who watched their loved ones die. Post-traumatic stress disorders have arisen from that, and we haven't been able to solve all that. So it's not even just gender inequality or gender abuse, female abuse, because the women were actually at the receiving end. In any adversity, the women and children, they are always at the they're always at the difficult ends, you know. So at the end of the day, these issues have not reversed. We haven't actually been able to solve all these issues. COVID-19 pandemic came, caused social isolation for the elderly. The elderly's mental health was also in jeopardy. There are many things that this has done
everybody's mental health.
Yes,
everybody's mental health.
There are things that you cannot escape from, okay? Like the pandemic came. To avoid the spread of the infectious diseases, people have to stay at home. At that point, the people should, you know, develop coping skills, coping styles. Now, organization can also help us. Organizations in different places should be able to, you know, carry out programs to help people learn what we call soft skills. Organizations, sometimes what they do is technical skills. They train people on technical skills. They don't really carry out what we call training on soft skills, communication skills, coping skills, so that people don't adopt maladaptive coping patterns, you know. Then stress management, you know, problem-solving skills. If organizations can, you know, educate people and train people, I think it will help the mental health of workers generally. Schools also, they should be able to train teachers, give teachers special training. When they see children in the school behaving in a particular direction, they will know that, okay, let me alert the parents or alert the principal. Parents also should also be taught. Schools can organize programs. These are ways we can help ourselves. I think education is key, actually, informing people and telling people, oh, if people are taught communication skills, a lot of that problems in the house of battering will be reduced, okay, because the woman will be able to communicate, know how to, you know, solve problems in the house and all of that. So matters don't escalate to the point of battering and all of that. So these are some ways we can actually help ourselves as humans. Yes.
Okay, now we talked about stigmatization, but unfortunately that is one thing that we just cannot push it under the carpet. No matter how small, the moment you hear, even if you see somebody walking towards the psychiatric hospital gate, you know, like there was a time I went there to interview somebody, and I saw a person that I knew, and after I greeted, he said, I did not come for treatment, I came to see somebody. I said, I didn't ask you. I didn't ask you, but I'm also here. He said, no, I can see you with camera, no, I know you came here to work. I said, you know, that kind of a thing. She was already on the defensive. I just greeted, and it ended there. So how do we solve or cope with the issue of stigmatization so that people who have problems, people get depressed without seeking medical assistance? You know, people just go under, they hit their lowest ebb, and nobody cares whether that person goes for medical attention or not. Even some families would not want to until things have gotten out of hands. Even when things get out of hands, they let the person loose, and nobody wants to be associated with such a person. How do we deal with the issue of stigmatization?
Education is the key, okay? Education is actually the key. Educate people. When you educate people, you empower them to know. I add to what you're saying. There was someone who came to the psychiatric hospital and found his boss there, okay? He stayed apart and watched and found the boss go through all the processes, followed her to the pharmacy and found that she got her drugs. And then he now came out. He's a he, and said, madam, you came here too. The mother now said, ask him, oh, because I have been trying to push him. He doesn't want to come here for treatment. And she said, well, if you don't come for treatment, you misbehave in the job, we'll lay you off. And that was the last. The mother never pushed that boy. The boy was now coming by himself. Now, if people can publicly come out to say, oh, they are stable, they've been functional, but they receive mental health treatment, I think that will go a long way. Maybe we should form an association of people who are stable, because there's actually some persons who are stable, who have been taking drugs, medications, yes, and they are doing well in their respective fields. I think it's those people that should come out to say, yes, they've been, okay, someone has been suffering for 20 years and he or she has made a mark, okay, in where he or she works. I don't think the person should be ashamed any longer to come out and say, yes, for the past number of years, this is what he or she has been through. And when they see the successes, the evidence of the stability, then other people will want to come out. I think education and getting people who are well to talk about it is the key. Just that people who are well are not even willing to talk about it, because
exactly
the impression people have, and especially the way it's being portrayed in social media, that's another problem we have to tackle. It's portrayed as though, oh, this person, oh, it's a witchcraft thing and all of that, and the portrayal is very bad. I think that area has to be addressed. There should be policies to ensure that if media, these are films and all of that, if they are going to portray someone who is mentally ill, they don't portray it in that light. We have different mental illness, okay? Depression is one of them. The ones we see in the street is actually a worst form of a subtype, of a diagnosis. It's a subtype, yes. The worst form of a subtype. We even have that subtype where people are stable and they are doing well. So one worst form of it is where you see people in the street. And those people in the street is because they do not have social support. There's nobody to help them to get their medications and make them to function minimally. Okay, and that's a very small percentage of people who are mentally ill. There are a lot of persons who are mentally ill and they are functional and they are stable. You won't know. But those people, they do it in them. Use the word codedly, and they don't,
very secret.
And they don't come out. It's actually shrouded in secrecy, this use of psychotropics. There are a lot of persons, I can tell you, there are a lot of persons. Some would want private, private consultation. There are a lot of persons like that. They don't want the whole world to know. They don't want to stay on queue. They just want private consultation. Okay, I'll give you an example. There's a colleague of mine who treats someone from Benin. He is in Lagos.
Oh.
The woman flies from Benin to Lutz to take treatment. Why? Because she doesn't want to be seen around here in UBTH. Probably people in Benin knows her. And so she flies to Lutz each time she wants to take treatment.
She goes through all of that trouble to avoid being stigmatized.
To avoid stigma. You understand? So I think if people can come out and say what it really is, I think it will go a long way, helping others who are ashamed or still afraid to come out.
Then I should give an award to a young man who came on one of our programs and said, after telling us, oh, my name is this is what I do for a living, and that, this is the kind of girl I desire. He said, but there's something that he suffered from schizophrenia or something like that.
Yeah, that's
and he said it, and I was touched. I said, why are you telling me? He said, because I want the woman to know when she sees me taking some kind of drugs, she should know, so that the woman would not be alarmed. Do you know till date that young man is yet to find a wife?
Yes.
Is yet to find a woman who will say, okay, I can cope. Because of this issue, each time I talk about him to some girls, so I just stop talking about him.
Yeah.
The response I get is, make it no go keep person for us. That kind of talk.
They are not all like.
He said, what if he failed to take his drug, or maybe something happened and then become violent and all of that, Stigmatization is something we're going to live with, because there's no how we're going to, walk over it. We can't glide over it.
But we can minimize it, actually. It can be minimized to the barest.
When family members will stigmatize, what do you want outsiders to do?
That's why education is key. That's why we keep talking about it. If someone comes and gives an example with himself, experience is the best teacher. It will go a long way helping someone. I would actually advise people, who are stable and they are functional in their respective fields to come and help the people who are still shy. I think that's what can help, because experience is actually the key to this.
So such a person must have a lot before he or she can come out. Because not, if that person is working, not only will that person have issues in the place of work.
That's why I said someone who is already established, someone who has recorded
Who is the
success.
master of, of
Yes,
himself.
someone who has recorded success, not one, not two. The person can come out, and when you look at the track of successes, then you will be able to say, if those person could record this amount of success, then there's no big deal. I can as well go for treatment. I think that's the way to go about it.
All right, at this point, I'd like you to call in, particularly those who are stable, like Dr. Mary said. If you have passed through this journey, if you have gone through this journey and you came out successful, or you're trying to be successful at the end of treatment and all of that, you can actually call in to, you know, admonish or advise or sensitize some other persons who is going through all of this. And the number is 052-290-573. That number is going to be on your screen shortly. It will be very important. It will be, in fact, you will be saving a life if you can do this. Now, doctor, let us look at, we've talked about some curses of all of this. Now, let's look at those who are actually very ill now. Is it possible to treat them? If you treat them, would they be okay? Would they be safe? Will they become normal?
Yes, it's a chronic illness that, you know, we're not talking about cure, okay? We're talking about control. It's
Yes.
like every other chronic ailment. We have ailments like diabetes, hypertension. People don't go for cure, they go for, you know, control. So you can actually control mental illnesses and the people will be stable. Because what is involved is actually neurotransmitters or chemicals in the brain. Okay, so some of the drugs that are used, they are to balance the chemicals, either to antagonize the chemicals that are in excess, or to beef up the ones that are in short supply in the brain. So that's actually basically what the drug does. So when people know that there is chemical imbalance, and these drugs is just to help them balance their chemicals, I think they'll be motivated to take them. And once they take them, to a large extent, they live a stable life. Just the way any chronic ailment is, that when people stop their drugs, they relapse. It's the same way mental illness is. But the problem we have is problem with compliance, problem with adherence to treatment. People don't want to adhere. When they take the drugs and they are well, they just stop and they just live up. That's what usually happens. And the way it goes is that some of the drugs, they are formulated in such a way that the fat cells of the body absorb some. So once some are used to balance the chemicals, others are, you know, stored in the fat cells on the body. So when somebody stops taking the drug, the person lives a functional life for some time, because the ones that are stored in the body system will be released gradually to help the person achieve stability. And after a while, once that is exhausted, the person breaks down and then the person have a relapse. That's what we find. But people are not willing to continue with the medication. That's the problem. Because of this stigma, okay, they just want to say that they are well and they are free from drugs. And when they try that, for some persons, it could be a question of months. But for some persons, they could stay for years without relapsing, without being on drugs, okay? Without relapsing, without being on drugs. After some years, then they now relapse. They now relapse after some years. Some, it could be a question of weeks, it could be a question of months. So what we're saying is that it's like every chronic illness. Once they're on medications, their chemicals are balanced, they live stable life. Okay, then like I told you, there are different types. The type that is actually have bad prognosis or poor prognosis is actually a very small percentage, and that's the one people see. The rest of them, the majority of the diagnoses, they have very good prognosis, and people are on pills Once they follow up with clinic attendance, they are stable.
Okay, sometimes ago, um, somewhere on this express in Oluko here, there was this young man who was incapacitated, and when you look at the man, you will say that this man is not really all right. Yet the man was left to fend for himself. You know, when you look at a situation like that, you begin to wonder, don't we have organizations or have government agencies that can take care of such a person? Now, if such a person is lucky enough to be brought to the hospital, do you think that person can be well again? Somebody who have really, really gone out there, you know, somebody who, let me just use that word now, not to, you know, abuse anybody. So somebody who have really gone mad.
Okay, actually,
Naked and all of that.
yes, there's what we call long-term psychosis.
Okay.
Okay, the prognosis for long-term psychosis is poorer. That's why we're talking about prompt diagnosis, early detection, and treatment. The length of stay of the illness has impact in recovery process.
Oh.
So when people have had this what we call long-term psychosis, chances of coming back to the original state are slimmer than when, if maybe it was diagnosed early and the person got support, family or social support, and the person has been taking medication for quite a long time. So what it means is that for such persons, they're actually brought to the hospital. We do our best to bring them to a manageable state where they are not aggressive, they are able to take care of their personal hygiene. But sometimes their cognition is actually affected. Yes, so sometimes they may not be able, in quotes, to now say, oh, they want to go to school because the extent of the damage. Yes, so but they can be very peaceful, not harmful to themselves and anybody. They are able to take care of their personal hygiene. But the problem we have is that such persons can't stay in the hospital forever. Sometimes when they are discharged, because there's no system in place, you know, to continually take care of them, sometimes some of them go back to the streets. So that's
let's look at the issue. Or there's this one now that is very trending, particularly in this state. I don't know if it's happening in other states. You find young girls, beautiful young girls who are in a terrible state of mental health problem. They are everywhere. I see them, a lot of them, not one, not two, not three. And so I'm beginning to wonder, does it have anything to do with drugs? Because these days we know that a lot of young girls do drugs. They do from shisha to marijuana, you name it, or even crack.
Yes.
So I'm beginning to wonder, does it have anything to, do you think it has anything to do with all of these drugs I've mentioned? You know?
Okay, it's not a matter of what I think. It's what I know. Okay. And you've actually also answered the question. Okay. Coping styles these days, people use drugs to cope with stress. So some persons, it's not as if they wanted to do drugs initially, but when the adversities in the world is actually overwhelming, a friend just say, take this and you feel good. They take it and then they feel good momentarily. But the problems are still there. The drug wanes off the system and they feel the need to take more. And they continue to take more. The body gets used to the drug. There's what we call tolerance. And then they begin to take more until they skip over. That's actually what happens. So use of psychoactive substance is a major problem we have. The majority, I was talking with someone in my clinic last week, and I was trying to tell the boy, why don't you go away from the drug culture? And he said, doctor, I can't count 5 youths that don't use drugs. I said, really? That's your opinion. I think there are people, it's just that where you are. Is that where I really don't know if it's where I am, but almost every youth where I am uses drugs. I was shocked. The boy tried to convince me that this I'm telling him to do is what he cannot do because everybody around him uses psychoactive substance.
What is the long-term effect of using of such drugs?
The long-term effect is For some people,
because as a youth, like the guy you're talking about now, sorry, as a youth, he's enjoying it. But what if he grows older than that? If it doesn't kill him in his youth?
yeah, he doesn't need to grow older. That's why he came to the clinic. Of course, for him to come to the clinic,
But there are
something
some
has
who would
gone.
never ever come to the clinic.
Yes, the body's makeup is different. You agree with me that there are some persons that can stay in cold environment, isn't it? There are some that cannot stay in under air condition.
Of course.
You agree with me?
Of course.
So the body system is different. There are some persons that once they take the drug today, they become ill and the next day they are brought to the hospital. We call it acute psychotic due to use of psychoactive substance, okay? Now there are some that after a while before they are brought to the hospital, there are some that in the long term before it will have effects on them. But I can tell you it does have effect depending on the person's system and the makeup, genetic makeup of the person. This brings me to what we call vulnerability, genetic makeup of individuals, okay? There are some persons that are vulnerable. Either they have a family history, but they are not aware, okay? So once they take that, it's a the word active. It acts on the brain, okay? It interacts with the chemicals in the brain, which maybe were not too balanced, and the person was just managing without knowing. And once that interaction takes place, the person, you know, tilts to the mentally ill direction. That's what usually happens. What about problems with alcohol? You know that in the long term, memory problems is heightened. And then the person, even in old age, if the person does not come to the service of mental health, maybe the person is not psychotic, the person would have other behavioral problems, memory lapses and all of that. Even if it doesn't have the short-term effect on people, it usually have a long-term effect. It has a relationship with schizophrenia. Studies have shown that cannabis specifically is associated with increased, you know, schizophrenia in people. It's a two-way relationship. Wow. Okay? There are some persons, because they're not sure of their minds. Their minds are playing pranks on them. They don't know what's happening to them, and they haven't spoken to anybody about it. So what they do drugs. Okay? They go use drugs, thinking that that will help them, you know, to gain their sanity. That's in one direction. The other way is that people who are vulnerable, okay, they are on the borderline, but they are not aware. Once they take the psychoactive substance, cannabis specifically, it tilts them towards schizophrenia. So for some persons who are not vulnerable, who will not come with schizophrenia, once they take psychoactive substance and they break down, when you treat them, they reverse. Once they don't take the psychoactive substance again, they become stable. But some that are vulnerable, by the time there's already an interaction, even when you now treat them, they need to continuously follow up with treatment and stop the use of that psychologically active drug to be able to remain stable. So that's the interaction. And studies have proved this.
So weaning somebody off this all these drugs that we've talked about now, is it something that can be done, say, within 3 months, a year? What's the time duration?
Actually, that's this protocol we follow in the hospital, okay, such that when the person comes in, it depends on the psychoactive substance the person is taking. Okay, there are drugs that can be given to mimic such, okay, and wean the person off gradually. It could be that there's what we call withdrawal effects of some of these drugs. It could be that it's just those withdrawal effects that is preventing the person. Maybe the person has tried severally, but because of these symptoms, is not able to help himself. So we give antidotes in that situation, okay, so that the withdrawal symptoms will be minimized. And once the drug is off the person's system, then the person now has the willpower to say no. Because at that initial stage, the person usually don't have the willpower. It's not
willpower.
within the person's confines to do that because of all these symptoms I told you about. Usually between around 12 weeks, 6 weeks to 12 weeks, we're sure that no traces of the drug is in the body person's body or system. Then we now encourage the person to go for psychological treatment, talking therapy and all of that. We engage the person. Then we teach the person coping styles. How would you cope? Because sometimes they tell us it's this stress and this stress that led to it. So how would you cope with that stress now? Because sometimes we are not able to go to the family to remove that stress. The stress is going to be there. So the person has to find other coping styles, other coping abilities to be able to, you know, prevent himself from this maladaptive behavior of using drugs. Then we engage the person, and then some of them, they have to change environment. They have to change environment. Very important. Okay. That just brings me to one point. There's this issue with housing. Someone narrated to me last week. The mother said, okay, where the father and the mother, they actually separated. So the mother said, okay, where you are in your father's house, the people around there, the drug culture is so strong. Leave there and go to my brother's house. And then the boy came and told me, doctor, I can't even stay in my uncle's house. You know why? I sleep on the chair, and sometimes rats and cockroaches. And so the housing is not convenient. You see why I say housing, employment, they are all social determinants of health.
I can imagine.
Yes, it's not convenient. So he is forced to go back to the father's house where he cannot pull out from friends. So these things are interwoven, okay? That's just brought to my mind now, this issue of housing affecting mental health of people. So that, coming back to the question, you actually helped. So that's the way we try to help them, talk to them. But before we do that, we have to ensure that the traces of the drug is not in the person's system and the person has the willpower to say yes or no, because the person is free from symptoms. That's the way we go about it. And some of them actually do well. Yes, they do well, especially when they have family and social support. What they do is that sometimes the relatives can relocate them. Some of them that were idle, give them some things to do. And once they are good at what they are doing, they have something to occupy them. They are not idle. They are usually able to overcome it. So
wow. It's been quite interesting, and then I was actually hoping that those who have survived this problem, I was hoping that they will call in to, like, you know, give us a word of encouragement. But we understand, okay? I know that from what the feelings I'm getting, we have quite a number of text messages. We'll read them, but unfortunately we cannot read them on set now. So, doctor, you've given us quite a lot to go and think about today. If you are trying to use drugs, don't. And if you have so many problems that is causing you mental stress, your best bet is to go to the hospital to see a psychiatrist. All right? You don't have to care about what people would say. Think about your state of mind. Think about your mental health. Think about how your state of mind, your mental health will affect those who are close to you. Doctor, one word before we go. At least tell somebody something that would help that person, particularly that person that does not know that he or she is on the border already, or that he or she has need to visit a psychiatrist.
Well, I think your health matters. Don't think about what people will say about you. What is important is that you're well and you're functional. So even if it means seeing a doctor, even if it means seeing a specialist, a psychiatrist, it doesn't really matter. What should matter to you is that you're well. That's the word I have for people.
Thank you, Dr. Mary, for finding time to be with us on the program. Please, a word to say is enough for the wise. Your health is in your hands. Nobody is going to help you with that. You will do that yourself. So we'll see you again. Bye-bye.
Thank you. Bye.